Do your travel plans have to be sidelined because you are pregnant? There's so many questions about what is safe and unsafe to do during pregnancy, and traveling while pregnant is actually one of them. Here to talk to us about when and where traveling is safe is Dr. Marcos Cordova. Good morning. Thanks so much for being here with us today.
Good morning. Thank you for having me.
Absolutely. So when is a good time to travel when you are pregnant?
Well, the best time to travel is in your second trimester, between 14 and 28-week gestation. It's basically because most of the complications that are going to happen usually happen in the first or third trimester.
Okay.
Also, you're going to feel better because probably nausea and vomiting is going to get better in the second trimester, and you're still able to travel easily. Sure. The second trimester.
And we're not instantly thinking flights all the time. How should they go about traveling? There are other modes of transportation they should consider. What's kind of the best if they can do it?
Well, you can actually consider to drive. That's safe. What I usually recommend my patients is to actually have like frequent stops, so you can empty your bladder as well as eat healthy snacks while you're traveling. You can also consider to, as you mentioned, flight as well. People travel a lot. Something that I recommend is to actually sit in the aisle so you can stand every 2 hours. Okay, and also do some exercise in your lower extremities to keep the blood flowing, and drink a lot of fluids. That's going to keep the circulation and prevent blood clots in your lower extremities.
Once again, if you're by the aisle, if you drink a lot of fluids, you can get to the bathroom faster too, right?
That's
As a pregnant woman, we all know what that was like, right? All right, and is there something as far as a mode of transportation really just try to stay away from?
Not really. No.
Okay.
Yeah.
All right, well, that's good. Okay, so is there anything a woman can do to actually make herself a little bit more comfortable when she's pregnant and traveling?
Right. Well, I usually recommend to dress comfortable clothing. Also, again, give yourself a lot of water. Something that it's important to know is that you should always have, like, eat healthy and keep healthy snacks. You know, it's like if you don't prepare yourself, then you're probably gonna keep eating things that may not be healthy.
Right.
So that's extremely important. And also, one of the things that I recommend, like if you're traveling far, keep yourself or bring yourself your prenatal records.
Oh, yes.
Just in case, like, if any complication happens, then, you know, you have your information with you so somebody can take care of you.
Yeah, because a lot of times, too, women get to that certain point where people really don't know if they're pregnant either. So if something happens, they pass out, they faint, then something like that would be a sure sign, like, okay, good, we know what's going on with her, we can check her out. So are there any areas or places that pregnant women should not travel?
Well, before you're traveling, most of the time it's safe wherever you go, but you should be aware of places that have Zika virus infection or malaria, which are two conditions that actually can affect the mom or the baby. So before you're traveling, talk to your doctor. Usually within the United States, it's safe, but if you're going outside United States, then consider to talk to your doctor. Usually Central and South America are areas of Zika virus, so you may consider to look and have some research about that before you go.
Sure. And unfortunately, if you are traveling and you do need that medical attention, how do you go about doing that, or who should you turn to? Do you, especially, I mean, if you're flying, that's always a big fear, right?
Right. Well, that's true. I mean, if you're flying, then, you know, somebody will have to take care of you.
Yeah.
But what I usually say is that things that you should be concerned about while you're traveling, if you start having contractions, like every 5 to 10 minutes, that will not go away in spite of like you sitting or resting for 45 minutes, then you should go to the nearest hospital. If you start having vaginal bleeding, if you actually think that your water broke, then you should also seek for assistance. And also, if you start having severe headache that will not go away, or blurred vision, those are symptoms that your blood pressure is going up. So if that happens, you should also look for assistance.
Right. So if you have any questions or concerns, don't question it, just go get it taken care of.
Go to the nearest hospital or call emergency services if any of these things happen.
All right. Thank you so much for the wonderful information.
Thank
and for
you.
more details, go to spectrumhealth.org. We'll be right back.